Hi, I'm Allie Ontko, and I'm doing my presentation on Duchenne muscular dystrophy. Duchenne muscular dystrophy is a type of genetic disorder that causes progressive muscle degeneration and weakness. This disorder typically presents itself in childhood, with it being commonly diagnosed between the ages of 3 to 6. Duchenne muscular dystrophy affects approximately 1 in 3,500 live births. I'd like to start out by discussing the pathophysiology of this disorder. Duchenne muscular dystrophy is a progressive muscular disorder that is related to a defective gene located on the 23rd chromosome, specifically the X chromosome. The defect causes dystrophin to be absent, which is a muscle protein. The lack of dystrophin causes those affected to experience progressive muscle weakness and degeneration. Duchenne muscular dystrophy is considered an X-linked recessive disorder. An X-linked recessive disorder means that women are carriers of the disorder and it is expressed in their male offspring. This disorder starts out with generalized weakness of the voluntary muscles and then progresses to more extensive weakness. The child has no alterations in the spinal cord or peripheral nerves. Instead, the absence of dystrophin affects the skeletal muscle fibers, causing them to function improperly. As the disease progresses, eventually the cardiac and respiratory muscles become weak and the child will progress to death. Typically, Duchenne muscular dystrophy is fatal by the time the child reaches the ages of 20 to 25. Now I'd like to discuss signs and symptoms of Duchenne muscular dystrophy. The child with Duchenne muscular dystrophy presents with muscle weakness, which is the number one sign related to the disorder. Most often, the more proximal muscles and muscles of the lower extremities are the first muscles to be affected by muscle weakness. The health history of a child with DMD may elicit that the child began walking at a later age than what is considered developmentally normal. A finding consistent with DMD in toddlers is hypertrophy of the calves. Gower's sign is one of the most clinically significant findings in the child with Duchenne muscular dystrophy. Gower's sign is the child's unique way of rising from a sitting to a standing position. As you can see in the graphic to the right, the child needs to roll onto his hands and knees. Then he uses his hands to support some of his weight while raising his back. He then walks his hands up his legs to assume the standing position. Clumsiness and falling is often seen in preschool-age children with DMD. As well, the preschool-age child has trouble climbing stairs and running. As DMD progresses, the school-age child may exhibit a waddling gait or may walk on the balls of the feet or on the tips of the toes. Balance is affected with those with the disorder, and as the disorder progresses, ambulation becomes more difficult. The child with Duchenne muscular dystrophy will lose function in the lower extremities, upper extremities, and trunk musculature as the disease progresses. During the physical assessment of the child with DMD, it is important to auscultate both the heart and lung sounds. Typically, tachycardia will be experienced by the child as the heart weakens and lung sounds become diminished as respiratory function decreases. Now I'm going to discuss some diagnostic tests and results that are commonly found in the child with Duchenne muscular dystrophy. The top picture depicts an EMG, also known as an electromyography, being performed. In the child with DMD, this test confirms that there is an issue with the muscle but does not specifically confirm a diagnosis of DMD. Serum creatine kinase levels are elevated initially in the child with Duchenne muscular dystrophy. This blood test detects high levels of active muscle wasting. The muscle biopsy specifically confirms the diagnosis of Duchenne muscular dystrophy. The biopsy will show that the protein dystrophin is not present in the muscle tissue. As well, DNA testing will show the presence of the defective gene. Now I'm going to be discussing treatments that are associated with Duchenne muscular dystrophy. First things first, despite many medical advances in the care of Duchenne muscular dystrophy, there is still no cure for this disease. Often, treatment for DMD is supportive therapies because of the progressive nature of the disorder. Children with DMD need a multidisciplinary team to help care for their many different needs related to their condition. Some examples of healthcare professionals involved in the care of the child with DMD include PTs, OTs, cardiologists, pulmonologists, speech therapy, and dietitians. Medications such as glucocorticoids, ACE inhibitors, ARBs, and beta blockers are used in the treatment of DMD. I will be discussing these medications in a later slide and their use in the treatment of the disorder. Assistive devices used in the treatment of DMD include braces and orthotics. Braces and orthotics may be used to help prevent contractures, which are a common complication in those with Duchenne muscular dystrophy. As well, the child will most likely require the use of a wheelchair as the disease progresses and the child loses function of his lower extremities. Spinal surgical fixation may be required because many of these children end up having spinal deformities, such as lordosis, which affects mobility and function. The surgical fixation is performed using a rod to help keep the child's spine in alignment. As well, another type of surgical procedure that may be performed is a tendon release to help relieve the contractures that are caused because of the immobility of the muscles. OT and PT are important to help the child with their mobility and function in both gross and fine motor skills, which are both affected by this disorder. Now I'm going to discuss nursing interventions and their associated rationales for the child with Duchenne muscular dystrophy. Promoting mobility is critical to helping manage muscular weakness and degeneration caused by DMD. An example of a nursing intervention related to promoting mobility is to perform passive range of motion exercises multiple times a day. This is done to preserve mobility and prevent muscular atrophy. A second nursing intervention is to encourage the child to bear at least minimal weight when standing in order to promote improved circulation, healthier bones, and a straight spine. A third nursing intervention is to apply orthotic devices as ordered in order to prevent joint contractures. A fourth nursing intervention is to schedule the majority of the child's activities during the day when he has the most energy. This is done to promote independence and prevent easy fatigue. Another important category of nursing interventions in the care of the child with Duchenne muscular dystrophy is maintaining cardiopulmonary function. This is critical because as the disorder progresses, respiratory and cardiac musculature, as well as function, decreases. One nursing intervention is to encourage coughing and deep breathing exercises daily in order to strengthen respiratory musculature and encourage expectoration of any secretions. Another nursing intervention is to encourage use of the incentive spirometer. It's encouraged to be used 10 times every 2 hours in order to prevent atelectasis and strengthen respiratory musculature. Medications that are used in the care of those with Duchenne muscular dystrophy are glucocorticoids, ACE inhibitors, ARBs, and beta blockers. Glucocorticoids are often prescribed for the treatment of this disorder because of their ability to slow the progression of DMD. It is believed that glucocorticoids, such as prednisone, protect the muscle fibers from damage to the sarcolemma. Studies have shown that treatment with prednisone results in increased function and strength. Pulmonary function is also shown to be improved in those that took prednisone for DMD. For example, a study found that after taking prednisone daily for 6 months that forced vital capacity improved by 11% compared to those that received a placebo. ACE inhibitors, ARBs, or beta blockers are prescribed to children with DMD to reduce cardiac muscle deterioration. It is suggested that these medications be prescribed and taken as soon as an abnormality such as cardiomyopathy is seen on the EKG, but before the child starts to experience these symptoms.